hustle when we grind to get to where we're at. Our purpose we will find, so we gotta stay on track. Wasn't easy for no one, life is tough, we understand. No, you're the chosen one, this is all part of the plan.
It's all part of the plan and it's game time. Regardless of the struggle, man, we still grind. Always motivated and hustle, so we all rise. Minority Report, future bright, so we all shine. Let's go.
All I ever wanted was my dream. It's like you want it ever what it seems. I want the life you better hustle, hustle hard. You tell me I can do it, I go hard. And they gon' know I did it from the start. You want it all, you gotta hustle, hustle, hustle.
This is
The Minority Report
Movement.
The views, thoughts, and opinions on this podcast are solely ours and do not reflect the institutions and organizations we are affiliated with. Episode 5, Flexibility. Please enjoy. All right, y'all. Welcome to another episode of the Minority Report. It's Aaron Hunro, and I am here with my gentlemen right here, Sato, Carl, and Carlos. And we're here to talk to you about something that affected not just us in PA school, but everybody. I'm talking pandemic-wide. And that topic today is COVID-19. So today we're going to talk about how COVID-19 affected us during PA school. Now, if you guys been following, all four of us are in our clinical year of PA school. So we didn't have to do much of that remote learning for didactics because of COVID-19. But we all had some different experiences with it. Some good, some bad. And here we're here to share with you our experiences going through rotations with COVID-19, how we felt supported, how we didn't, what we thought, and where we are now and what we've been doing. So without further ado, I'm going to go ahead and have Sato kick us off.
So for me, I've been out of clinical rotation since March, mid-March. Still haven't gone back yet. I'm not planning to go back until June 15th, which is about 2 weeks from now. Little under 2 weeks now. I mean, it's affected me quite a bit. I mean, I've been out, 3 months almost. Haven't touched a single patient during those 3 months. Been doing a lot of advanced clinical electives, which is basically didactic work. Lots of watching online meta videos, watching, EM core podcasts, IM core podcasts, basically a lot of podcasts. Doing these aquifer cases, just having to do a lot of projects and stuff, a lot of busy work. Definitely not ideal, since coming into PA school, we all expected to have 12 months of clinical experience, where we got 4-week rotations, 12 rotations total. I lost out on 7.5 weeks of rotations. Unfortunately, 5 of those weeks is ER, which I plan on going into after I'm done with PA school, so that kind of hurt a lot. Honestly, I was frustrated. Paying $44,000 a year for education that I'm not getting. Losing out on 7.5 weeks, that's almost 20% of my clinical year. It was pretty frustrating. I think I'm a lot better now mentally. Things happen. They're completely out of our control, out of my program's control. No one expected a worldwide pandemic to come through during, our PA school. I mean, it is what it is. The only thing we can do is, stay flexible, try to, make the best of every situation, try to learn as much as I possibly can through, online resources and stuff like that, and just go from there.
Yeah. Definitely. What about you, Carl?
Okay, so my experience was a little different. So we was finishing up, I think it was the 4th rotation. I had pediatric emergency medicine. So luckily for us, the hospital just started to limit students kind of around the same time we were getting in between our rotations. So I guess that kind of helped the program a little bit, because we had just finished this rotation. We had a little break. So they had a little time to kind of adjust a little bit and prepare us to kind of continue through the pandemic. So also my program is straight through. It's a little different than yours, Sato. 27 months straight through. Didactic is 12 months, followed by the clinical portion, which is 15 months. So we do like 6 5-week rotations and then like 2 11-week rotations. So they pretty much adjusted those the weeks per rotation. And they adjusted the rotation part kind of by like supplementing. We did a lot of virtual sessions, online work, and the breaks that we would have had, they kind of canceled those, and now we're just going to kind of run straight through them. So I actually just started back in the hospital this week, just had orientation. I'm at an urgent care, and the atmosphere is just completely different. When I was there before, obviously no one was wearing masks unless it was, a certain precaution. Now, everyone's wearing a mask, and, everyone's trying to keep that distance, but it's a little difficult, especially in the urgent care, it's pretty small. And I guess how our urgent care is broken into during like COVID, like urgent cares are just designated for COVID patients, and then some that's kind of not. So that's where I'm kind of at, but it can vary. Who knows? Who'll come through the door, and with a lot of people being asymptomatic, you always got to err on that side that could possibly be a COVID patient. So we'll see how how this pans out.
Yeah, for sure, man. How about you, Carlos?
So we were pulled from rotations maybe like early March. We had just completed our first week of our 8th rotation when we got the email over the weekend saying, it started kind of like a day by day, like tomorrow you guys, are to stay home while we figure the details out. And then after like 2 days of that, they were like, okay, you guys are going to stay home indefinitely. Hospitals have made the decision to keep you guys home, to save PPE and to not put you guys at risk. So for me, it's been unfortunate in the sense that, as Sato was mentioning, that you are losing out on that valuable clinical exposure as well as those connections that you would have made and skills you would have picked up by seeing a variety of cases. But on the flip side, I was personally also worried about graduating on time since our graduation is mid-July. So I was, concerned about what that meant as far as, was graduation going to be pushed back? Would they expect another tuition payment? What did all that look like? But fortunately for me, I had already completed all of my core rotations, and all I had left was two electives and a primary care. So although it did suck to miss out on the experience of that, it has been, I guess the bright side is I've been able to do the same, similar work they're doing with online courses and Aquifer modules, but also not be so concerned about will I be able to graduate on time, given that the rest of my work could be completed through like the online learning component. So I know my program went back to clinicals, those that had remaining core clinicals about 3 weeks ago. And we're still set to graduate mid-July, all on time. So I think for the positive aspects, I definitely have appreciated how, the response of the clinical team and how they've managed to kind of make the best out of these trying times.
Yeah, definitely. I feel like there was a lot to juggle with for the clinical team, especially, didactic portion. Yeah, they got to, make that adjustment for PA school. In terms of making the modules online, making the lectures online. But for clinicals, there's so many moving parts, right? Because everybody's at different locations, especially like for us, when they pulled me out, it was after a couple of my classmates, but at the same time before majority of my class. So I was doing my emergency medicine rotation. I was in starting my 5th week. I apologize. Ending my 4th week of my 6th week there. And I get an email from our clinical coordinator saying, hey, that hospital has pulled all of the students out because of COVID. And it was an interesting lead up too, because I'm not sure if you guys had any contact with any COVID patients at that time, but I remember that week on that Monday, on that Monday of that week, I had a shift, and my preceptor was like, hey, be careful, we got a positive case, just be really careful. A couple days later, he's like, hey, we got a couple more cases, And then next thing I know, I'm pulled out, and the same thing goes, I think, everywhere. PPE was short. Protocol was like all miscombobulated. Like nobody knew who needed a test, who fit what criteria. Like there was a patient, I could have sworn she was going to be positive, right? Her x-ray looked horrible. CT looked horrible. All the symptoms, all the, contacts and stuff like that. And CDC goes, oh, she doesn't meet criteria. She meet criteria. She's a low risk patient. And we were just like, low risk, then what do you want us to, you know what I mean? Like, how are you able to even determine that, But anyway, so they pulled us out. Been out since, mid-March as well, like these fellas. And it was a huge adjustment for everybody, especially the clinical team, like what Carlos was saying. And, they didn't want us to just miss everything. And unlike Carl's situation where, he was finishing up a rotation, I was in the middle of mine. So I had to do a few case studies, and I had the option to go back once the hospital opened up so I can finish up, my hours. I hit my patient contact limit, or requirement. I mean, but hours wise, I still needed to make a couple shifts up, but I still had to study for my EOR exam. Still had to take that remotely. All my classmates had to take our EOR exam remote, and get it proctored and all that stuff like that. So it was definitely an adjustment for everybody. And as of right now, we're still slated to graduate on time in November. We're supposed to start back up, same as Sato, in mid-June, June 15th. Some of my classmates have started this week. Some start next week. It just depends on the location of their rotation and the specialty. But, even with what's going on, we also had to do the online modules like Aquifer. I think everybody pretty much had to do Aquifer cases, right? Like, that was just kind of like the name of the rotation game, clinical rotation game.
Yeah, I think you brought up a good point. I feel like definitely the clinical staffs and every single PA program, around the country kind of, did what they could, did their best. I mean, I was definitely frustrated at first, you wait all these years to get into PA school, and then, you lose out on a big chunk. You're not getting exactly what you paid for. It was definitely extremely frustrating at first, but like Carlos said, you kind of have to look on the bright side of things, right? I still do get to graduate on time. I'm leaving North Carolina earlier than I was going to, because my last elective got canceled, and I can do my senior seminar from home. So I'm leaving here, I think, 3 weeks earlier than I was planning to. So that's awesome.
Yeah.
So.
And honestly, I feel like, as frustrating as this has been, we've all been flexible. Our program has been flexible. The hospitals and preceptors have been flexible, and our classmates as well. But I think also we got to be thankful that we didn't contract COVID-19 when we were out in rotations too, right? Like, we're home
that
safe.
We know of.
That we know of, right?
That we know of, right?
And we all stayed home, stayed safe, except some people put themselves in harm's way by going to volunteer at testing, but that's whatever. But so Carlos, how about you? How do you feel like your program handled it?
I think at first, I think that the response initially was amazing. They were quick to admit that there were a lot of unknown components, but to kind of just be flexible and work with them, because they were trying to figure out all of these moving pieces. I think the communication was good from the start about what to expect, what they didn't know. And I think sometimes just admitting that you don't know what the next plan because of all of these, big players, hospitals, clinics, was important for us. I know I've heard of other programs who kind of kept people in the dark for a week, 2 weeks without hearing any updates. And when you're, either close to graduating or you're in the middle of rotation, you kind of want to hear an update. Like, how does this affect me? Am I going to finish? Am I supposed to finish this at the end? Are we going back soon? Should I go back home for those that were, living in another state? So I definitely appreciate the communication early on from that. And definitely the work that they put together for us to complete part of this whole part of the reason that I'm even doing this podcast is because the program decided to add that component into one of our requirements, which I thought was very cool of them. It allowed you to think outside the box, apply what you're learning through these modules, and actually do something with it.
Yeah, I
Yeah.
agree.
How about you, Carl?
The communication, I feel like was pretty good on our end. The president of the university would put out some information. It was pretty vague, but then our program director would take that and pretty much translate that to something that we could pretty much digest. We're like, okay, look, this is what's going on. This is how it's going to affect you guys. Initially through like email and stuff like that, and then if a lot of concerns come about, they would set up a Zoom meeting weekly, if need be, and we would all get on there and express our concerns, and they never rushed us off the calls or anything like that. And again, down to the clinical coordinators, those guys, although they're working on us on the clinical side, they still have a role with the didactic students. So trying to balance that, I can understand, be frustrating. And then dealing with, 80 plus or however many sites, that school may have can be overwhelming at some point. So I think, and also, preceptors, some of the preceptors reached out. Like I was supposed to be doing surgery right now. And as you know, most surgery, I'm not gonna say most surgery, but some of the surgery that we guys do is more so elective. Like for instance, I like ortho lined up. So they're not seeing many patients. So they just more so erring on the side of caution, making sure that we didn't go in there unless there was enough PPE, make sure, we were safe. And essentially how it panned out is me being at urgent care, which is a little more flexible, a little more hands-on the front lines, and it made sense. So, I can't complain but so much because here we are now,
Yeah. And I mean, again, like you said, here we are now. What have you guys been doing in the meantime, aside from, the aquifer cases and just the online modules I'm sure that we've all had to go through?
I've been golfing a ton. I mean, I think I've played, honestly, I've played more golf in the last, I want to say, month than I have in the last probably 10 years combined. Just being able to get out, be out in the sun, work on my tan, just being able to get some exercise in. I was playing a lot of tennis until, they no longer let us play tennis with the stay-at-home orders. I go out for walks. My friend brought her dog back from Atlanta, so we've been taking that dog out for walks and stuff like that. Just doing something to get myself out of the house because I've never been a homebody, and so being able to get out was kind of a nice stress relief. Definitely, allows you to take little mental breaks away from, aquifer cases and podcasts and stuff like that because you can only listen to so many of those before, you slowly start getting a little anxious or stressed, a little down on yourself. So it's definitely important to get out of here.
Sure. How about you guys?
I've been, I think, stretching myself a bit thin with just adding, stuff to my plate now that I have a little more free time since I'm not in clinic seeing patients. Obviously the aquifer cases they take, I guess, depending on what you do, but they can take a long time if you actually go in depth and do the extra reading that they give you. But aside from that, I've also have been getting back to programming. So I've been building websites for clients as a freelance developer. working with these guys on the podcast. And definitely, I think the common theme is going on walks, very long walks to kind of disconnect either at the beginning or the end of the day after, doing a lot of work.
Yeah, for sure. And I apologize, guys. I know we've been throwing out aquifer just because we know about it. But for our listeners who don't know what aquifer is, one of you guys care to explain?
I mean, they're pretty much just like case studies. You kind of get put inside the vignette itself, I guess, or a scenario that plays out, and you're the medical student that's working with a doctor of some sort. And then depending on, there's internal medicine, peds, family medicine, geriatric,
Radiology.
Radiology. Is that the diagnostic one? Something diagnostic.
I think so.
I think I'm missing like one more category, but you basically, kind of play the scenario out. You ask them for like history and stuff. They have like little questions that you can ask, and they tell you what the answers are, and you kind of just play through the scenario. There's little, multiple choice questions thrown there, here and there. There's like a section where you can write out a quick little, 3-sentence report on what you tell your preceptor, what the, I guess for the most part, it's like the OPQRST, the onset, palliative, provocations, or whatever the P stands for, quality, radiation.
Qualitative, provocation.
Severity. I go with old. I go with old cards. I don't know about y'all.
Old cards for sure.
Yeah.
I do the OPQRST.
I'm an EMT, so
yeah, same.
So OPQRST. I just don't know what any of the letters actually stand for.
Yeah, so we're not using Aquifer. I thought it was a similar program. Ours is a little different. It's called iHuman. It's pretty annoying because you got like this patient that's like breathing and coughing, and I mean, this is what normal patients do, but it's a little computerized patient, with a little smart mouth, and like you try to answer these questions, you're like, no, but it's different, because when you see a real patient, you kind of can adjust on the fly, paint your questions around there, which you could kind of do on this online version, but it's more, template based. So it's kind of like real structured. But yeah, you go through the whole history, you go through the whole physical. And they have like a lot of study tips in between, like little questions in between there. Also a portion where you could go back and review their past medical history. And then you pretty much take that and then you come up with like a differential diagnosis. And then, you pretty much decide what type of test you want to run. So it's like a whole long list of like, maybe 300 plus, tests that you have to pick which one is, right for this patient, pertaining to whatever diagnosis you might have suggested. And then you go in there, do the whole assessment and plan, and then get some feedback. So in theory, it's pretty good, but
right.
Doing it is pretty
in practice,
tedious.
it's like annoying,
so,
right?
Mm-hmm.
Yeah. I think we all have a similar opinion. I'm not a very big fan of aquifer. I mean, you end up spending hours doing aquifer, and I feel like I learn more from seeing. It's like one of those things where I can still remember the patient where I saw pheochromocytoma for the first time, and that was like 6-7 years ago. I mean, it's more memorable and it sticks to my brain better when I see a patient with a certain condition rather than reading it off a vignette or a case or reading it on a piece of paper for that matter.
And I'm sure having a live preceptor helps a lot better than a picture of a preceptor, right?
Yeah.
But I mean, aside from the cases, has your school provided or required any other modules or extra learning material that you had to do? For example, we had to do a substance use module, right? So we were trained on, how to notice it and how to address it, and pretty much like when we get out there, when we're prescribing, medications against certain substances, or when patients have that abuse or that use, it doesn't even have to be an opiate. It can be, substance abuse with alcohol or marijuana or whatever it may be. So we're getting a good module in terms of learning about that. another module we had was a burnout module. I thought was pretty crucial. It was spread out for, a long period of time, but for the most part, it was very valuable. It really made me think about who I was as a future provider in terms of self-care. And, people talk about that all the time, but us being who we are, the go-getters, we rarely do take time for self-care, take time to prevent burnout and stuff. So I thought this module was very applicable. And I feel like, it's something that a lot of programs do need to start incorporating, burnout for providers as we enter the workforce where we will have instances of burnout. And then finally, they close us off with some telemedicine, telehealth modules. So we got some cases that we got to do. We have some guest lectures coming in, 2 different tracks. One was like a specialty track for, various specialties. And the other one was a interesting sickle cell disease track. And just a handful of us picked that one. So I thought that was extremely interesting, very valuable, especially, if I want to practice primary care here out in Southern California. There's so many sickle cell disease patients who don't have the proper care. And a lot of times when they go into the ER with a pain crisis, a lot of the providers don't know how to address it, right? And so really understanding and learning about that aspect, I thought was valuable. But how about you guys? Any other extra modules that you guys had to do?
Yeah, so we've been doing this thing called MAT training, medication for like addicted treatment. It's like a 24-hour long course, pretty much for when we start practicing, allowing us to be able to prescribe like treatment for those with addiction, which I think is really relevant and important, especially I would say where I'm from in Philadelphia. I live not too far from an area called Kensington, which is they call it the opioid epidemic or center of America, where there's so many people on, heroin, cocaine, all different type of drugs like that. So I think that's definitely necessary for us going back in the community to be equipped with that extra tool. So we didn't do a burnout class. I think that would be really important. I know you can relate to that. I know that time you almost had a burnout when you had the rhabdo.
Bro, that's another podcast episode. Oh man, bringing back PTSD, bro.
Yeah, that teaches me every time I go in the clinic. Drink water, take it slow,
eat food, don't work out after a 12-hour shift.
But one more thing is I think we need a finance class before we graduate. I think that'd be vital.
So just real quick shout out. I mean, since we're talking about the finance real quick, there is a recent grad PA. His website and company is called APP Finance. We could link it, but I actually just had a call with him in terms of talking about my student loans and what I owe, and talking about finances in terms of after PA school and how to get that loan down, and talk about different programs and stuff. So we could definitely discuss that later, but I just kind of wanted to throw that out there since we were on that subject real quick.
Yeah, for sure.
Yeah. I mean, I think finance is huge because I think finances might, kind of go hand in hand with the burnout, or like talk about like, salary versus hourly, the pay structure, what to expect. I think a lot of us, we worked jobs that paid us, $9-10 an hour, something less than 15. So, we're used to making 30-40 grand a year, somewhere around there. And when, you finish PA school and all of a sudden you get your first job, they're like, oh, we'll give you 85 grand, 90 grand. And you're like, dude, that's like 3 times as much as I used to make. Yeah, absolutely. Sign me up. Right. But little do you realize that the job that you're working is 60 hours a week and you're getting paid $80-90 an hour. Right. As a PA, especially in like an urban area in a place like California where, we are pretty popular, you have no business getting paid 85-90 grand a year. I'm sorry. That comes out to 40 something dollars an hour, $45 an hour, something like that. After your taxes and all that stuff, I mean, you're not making very much, and that forces you, and plus if that's like for a 40-hour week, for a 60-hour week, you might be getting paid like $30 an hour, $35 an hour, right? And that ends up contributing to the burnout because you're like, oh man, well, I'm working all these hours and I'm not getting paid very much, and I still got to pay my 6-figure loan that I took out, and then you got to spread that out over, 10 years, 15 years, 20 years, whatever it is, right? You still got to be able to afford a house that's, close to $1 million, because that's how much houses are in Southern California. You got to buy a car because you can't drive to work without a car, and you don't want to be driving no bucket. So you got to buy that. There's a lot of factors that go on, financially, that definitely ends up playing a huge role, in your burnout as a PA, and I think that's something that, we haven't really talked to. I've talked to a couple of my peers from my program and other programs and stuff, and talked to them about, what they think about hourly versus, salary and stuff like that. And you really have to realize what your value is, right? Because if they start underpaying new grads like us coming out now, we shoot the people that follow us in the foot. Because if we're taking these low salaries, they're going to be like, oh, we got this person for 80 grand. All right, well, maybe we can get the next person for 75. The next person takes it. Oh, they're like, oh, maybe we can take the next person for 70. Right? We start devaluing our stuff, especially as new grads. It's just not a good precedent to set for our profession, in our opinion. And it's just going to add to your financial stress. It's going to add to you having to pick up side gigs, per diem gigs in order to make, ends meet. And, I know we didn't come in here to, make a lot of money, because otherwise I would have gone in a different career. Honestly, I'd be in business or something if I wanted to make money. We came in here so we could help people, but at the same time, you shouldn't have to sacrifice your financial stability, at the same time. You can do both, take care of people and maintain financial stability.
Sato's dropping a lot of knowledge on us, and I think we found our moderator for that for that podcast whenever we record it.
5 episodes.
Oh yeah, I think there's so much to talk about, and I think it's definitely a subject that I think most people, not even just like us as PA students, but most people don't really get enough education on. And I think this is a good segue to talk about the job hunt, since it's, we're talking about jobs.
Yeah. I think Carlos and I are job hunting right now. And, I came into PA school with a pretty good connection with an ER group. I worked for them for, I want to say, about close to 8 years. So I worked for an ER scribe company that, they hired, and then I ended up working for an ER scribe company that they owned pretty much. And then I worked as an ER tech in the same hospital, alongside a lot of my friends who are, the assistant director or, doctors that work there in the ER. So I came into PA school knowing that I had like a verbal contract that, when I'm done with PA school, I'm going to come back and I'm going to work for you guys, which was great, because I could coast through PA school stress-free from a job hunting perspective, but at the same time with the whole COVID-19 thing, there's hiring freezes. A lot of places are seeing them right now. There's a lot of hiring freezes. There's a lot of people getting furloughed, layoff, all that stuff. My biggest concern is, when all the hiring freeze ends, then you're going to have to compete with a lot of the experienced PAs, the ones that already have 3, 4, 5 years under their belt. And quite frankly, I think they have the upper hand, because a lot of jobs do request a 1 to 2 year experience, even though you're a new grad. Definitely encourage still applying to those, but I think it's going to be an uphill battle for a lot of our peers that are graduating pretty soon.
To play the other side of the fence about it, I feel like it could also potentially be beneficial for new grads and also harmful for the, seasoned PAs who are looking for the jobs as well. Because what if a private clinic is looking for a PA and they go with the new grad because that's the cheaper option, right?
Right.
So, it could potentially fall that way, but, like you said, most of the places that are looking to hire want seasoned or, PAs who have had that experience. My experience was interesting because my first rotation, I heard from a previous graduate from my program that they were offered a job after that rotation. And so for me, I was like gunning for that as well. I was like, yo, I love this clinic. I would love to work here one day. And I think that's where that rhabdo came in, where it was just like, constantly grinding to work there to show like, I want to work here, and pretty much burn myself out. But, long story short, I didn't get that offer, and I was a little disappointed. But, flexibility is like that's a year out. I can't commit to that, and they can't commit to that either. However, fortunately for my third rotation, I was able to, rotation after that, whatever it was, I did get, a soft offer, but knowing that I have a potential spot, like what you were saying, Sato, I think that alleviates some stress as well. But again, we got to be flexible with what options might come. I didn't say yes or no yet. So you got to just keep your options open, especially during rotations.
Yeah, so I haven't begun a job search yet, really, because like right now, I'm aware of the job freeze, and I'm like just getting into that 6-month window until I graduate, where they say it's kind of like that sweet spot. But two of the specialties that I am interested in, emergency and surgery, or a mixture of trauma, those were like the two rotations I had next, besides the primary care before the pandemic. So luckily before school, actually one of my friends who was my mentor was a PA student, and he was volunteering at a hospital. He just was pretty much volunteering, doing like whatever. It wasn't like in a specific service or anything. And he ended up meeting a PA, actually a chief PA in ortho surgery. And, he reached out to him. It's like, he heard that he was doing like an externship. And first that program was like really exclusive to people he either know or people in the hospital. But I guess, my friend, made a really good impression upon him and went through the program. And then I ended up meeting this guy at a open house. An open house that I like never go to. I really didn't even intend on going to. And I just ended up going to the one at Drexel. And the crazy thing is, I don't even remember if I talked to anyone from the PA program at the thing, but I just remember seeing him, and we just kind of like was talking, I guess waiting for the person to get there. And he, we just kind of hit it off as far as just like talking about why we're here and just kind of like where we come from and like our goals and our vision. And he was like, look, I'm doing this program here. I think it's a really good look. If you're interested, I could try to put a word in for you. Now, again, I don't know this person, from a can of paint, but, he decided to open that door for me. And I remember it was like a while trying to get in touch with the PA because he'd been super busy. But eventually I remember he called me like out of nowhere. I might have like just come out of class or something like that. And I seen his call. I'm like, oh, so quickly ran, and answered that. And, from there, it was great. He allowed me to be in his externship program. I was there for, a couple weeks, and I learned so much. And I just put my all into it. And he was like, look, when you do your rotations, look out, as far as like put this site down, and, we'll see. He'll see what he can do as far as just trying to let me rotate there, essentially. So I'm like, yeah, sure. I didn't think much of it because, rotations are so far out. I'm just trying to get into the door. Like, I'm just trying to get into school at this point. But, I never forgot that. He never forgot that. And when it was time to pick rotations, I was able to, get that slot. Unfortunately, with the pandemic, it didn't pan out as far as timing-wise. I would have been in that now, but they're not seeing many patients now. So most likely I'll be doing that next rotation. So between that and ER, I can't stress the importance of taking rotations as serious, job interviews, because that's essentially what they are, they're like apprenticeship. It's like your chance to show them, what you're made of, what you can contribute. Because when you're just applying, you're just essentially, a statistic on a paper, as far as how well your resume is, how well your CV is, but they don't know as far as your work ethic. So this is your time to really prove that. So, that's what I'm looking forward to doing at a time like this, when it's a freeze and it's a little difficult to get in the door, you have to kind of rely on these connections that you built. And that goes back to like networking and things of that nature. So, I'm looking forward to this. And, what I can say to other students out there is, even if you don't, you set up something or you make a great impression and you just don't get that job, maybe because they're not hiring or whatever the case may be, they won't forget you. They might know somebody else who has a position open, and they'll be like, hey, I knew this student. He did this, that, and a third, and I think he might be a good fit for you. He or she may be a good fit for you. So, that's where I'm at with it as far as right now.
I think I agree with Carl there. The networking thing. Shameless plug for our first or second episode. We talked about networking. It doesn't matter how big or how small it is. Networking is what's going to get you, through life and to be honest with you, there's so many things that have happened to all of us just by knowing the right person. I don't remember which podcast episode it is. I think you should watch all of them, to be honest with you. Not that I'm biased or anything like that, but just networking. And then there was another thing that you said, Carl, that I thought was good.
Everything is
the job. Right. I mean, everything that Carl says is good, but it was about the rotations. In my case, I have 12 rotations. Carl, I forget how many you said you had, but
a lot.
A lot, right? I mean, you can take every single rotation is essentially a free job interview without even having to submit all the paperwork and having to click all these buttons and whatnot, right?
Mm-hmm.
I mean, there's so many opportunities for you. Even if you do poorly in one rotation, it doesn't mean you're going to do poorly for the remainder of them. You can always bounce back. Sometimes the rotation's not a right fit, the clinic's not a right fit. Things happen.
It might be your first rotation, right?
Right. So there's definitely plenty of people get offers during rotations and stuff like that.
Yeah,
so if it's something that you're interested in,
I'm
even
sorry,
if it's not something.
No, I'm sorry, Sato. I just wanted to say, when you're doing these rotations, this is the time to really show what you can't put on your resume, which is your character. That's just something that is either you got it or you don't. You can't really see that on a piece of paper. So that's your time to shine and show, what you're truly made of, and they'll pick that up.
Yeah, absolutely.
I'm definitely glad you were able to still make that happen, even though COVID has shifted things around. I just started the job search. I guess this is my second week officially. I never really, I guess my whole plan this entire time was to kind of just relax and graduate, sit for boards, and then just kind of slowly look for a job. I mean, without any pressure, just to find something that I was really sure that it would be a fit for me and I'd be a fit for their work culture. But just seeing my classmates and others get, job offers, and then with the hiring freeze, I started to get a little nervous. I think man, maybe I should start reaching out and just seeing what's out there. I think there's a little bit of irony within all this, because I would have never expected to be concerned to get a job coming into healthcare, because, this is a pandemic, you need healthcare workers, and yet you're getting laid off and furloughed. I think it definitely reveals some kind of irony there. But needless to say, the jobs, there's definitely still jobs out there. I think what I'm finding personally is that they just don't necessarily align with what I want to do, which is, internal medicine, emergency medicine, something along those lines. And I'm not really feeling super pressured to find something and commit to something right off the bat. I am applying. I think some tips for those in the future to apply is keep everything centralized in one folder, because a lot of them ask for repetitive, the same things, like my transcript, because I'm still a student. They want to see my transcript, I guess, to prove that I am in PA school. And then cover letters, it's really easy to, have one cover letter and then just modify that accordingly to each place that you apply to. But in general, still, I had an interview today over the phone. It was pretty laid back. But I'm not really sure, again, if that's what I want to do. And without feeling that pressure, I'm kind of just feeling options out and see what's the best fit for me.
Yeah, definitely, man. It's a lot to take in, especially with what's going on with COVID-19 and trying to graduate, trying to prepare for the pants. That's totally another huge topic that we got to talk about too. But I appreciate you guys giving your insight and experiences about going through clinical rotations, going through PA school in general during a pandemic like this. This is unprecedented, but I appreciate you guys as always. Any other closing marks before we have Carl reveal our MRP for today?
I think, there's a couple questions out there, like what can pre-PA students, what should they be doing or what they should be asking, prospective programs. You guys have anything, you want to add on that or,
I've been giving some advice to some people that have reached out to me. I think this is a good time for those. My path to PA school was, working a full-time job while trying to get all my prereqs in. And I think they have a unique opportunity right now to take online classes that normally probably wouldn't have been accepted by programs. So you can maximize your time while, still working a job, not having to commute to class, and just making your timeline for applying much more efficient. As far as what they should be asking, PA schools, I think it's important to ask them, like, how did you respond? How did you support your students throughout COVID-19?
Right.
Yeah, I think, Carlos, you hit a good point there. Like, what have they done for their PA students? Because we honestly don't know if this is coming back again next year. If it's coming back again the year after that. For all we know, this can be something that lasts for several years, where, programs are going to have to put things on pause. And if you're a prospective student, you want to know, well, what do the program do for their students? How did they take care of their students? How did they prioritize their students? And things that you want to know before you, sign up for, to apply to school or pay for a deposit or, choose to spend, several tens of thousands, if not hundreds of thousands of dollars of, your hard-earned cash over the next 15, 20 years. You want to know these kind of things, before you kind of sign up for one program over another.
Another thing to ask, I feel, would be, what are your clinical sites like? What connections do you have? Because, the more connections that a program might have, the more ability for them to get extra preceptors, especially ones who may take students earlier than others. I think that's super valuable as well to try to figure out and try to ask. And, pandemic or not, that's something that pre-PA students should ask, all programs and try to figure out what their clinical rotation affiliations are. So,
right. I think that's another perfect example of being flexible.
Perfect. Which leads us to our MRP for today.
Sometimes things don't go the way you want it to, and Carl gets too many phone calls.
Can you hear me?
Yeah, we can hear you now.
No, it wasn't a phone call. It was actually, it's something going on down in the city, like with the protests, and there was like an alert that came through the phone, and like between that shutting down and then my things dying. Oh my god!
It's all good,
all right,
bro.
can we pick it back up though?
Flexibility. Yeah.
Yeah. I think flexibility is key. We got our Minority Rapport Pearls of the MRP by.
Wait. Can I add my point to the
oh yeah, bro.
No, you missed your chance. No,
you gotta move.
You can't play
Sato, we gotta be flexible, bro.
You gotta be flexible.
No. I used up all my flexibility points. We're done.
Oh my god.
Go
ahead, Carl.
So Carl, what do you got for what pre-PA students should ask PA programs?
I think being up to date with how this pandemic is going to and pretty much is affecting healthcare as we speak. So I never was privy on politics, but this is really a great time to be aware of what's going on in politics. Like, of course, we need to know medicine, but we also need to know business, unfortunately, because this, healthcare is kind of ran as a business. So we need to understand laws and how to get certain issues passed that can, help our people, our community, and our profession. And that starts with us. It starts with you guys, the pre-PAs. And although also, most of you probably don't have too much pre-COVID healthcare experience to compare this to, but you can kind of still be privy on the changes that are being implemented today. So, for us, I feel like we pretty much have to adjust, be flexible. But for you guys, this is, pretty much the new norm for you guys. Of course, that's the thing about healthcare and life in general. You never know what's going to happen tomorrow. That's why it's important to be flexible, and to maintain your core values, your ethics, your morals, implicit biases, as a foundation. So, besides that, continue getting your prereqs done, application processes. I can't even talk processes, but application process complete, as well as ours. And again, like with the interview portion, yes, they're interviewing you, but you're also interviewing them. So specifically regarding to COVID, ask them how they adjusted, how they utilize their resources, if they were predominantly online because of the pandemic, or if they're flexible, as far as, providing a more inclusive experience. So, that's pretty much my take and, my advice for the pre-PAs out there.
Yeah, that's good. I agree.
That's awesome, man. Thank you so much. And
again,
guys, value the advice to the pre-PA students as always. Those are the people that we are using this platform for and advocating for, as well as welcoming, But Carl, so go ahead and hit us up with that MRP for this podcast.
Time for this episode's Minority Report Pearls. These are valuable tips from the Minority Report that are relevant to this episode's topic of discussion.
All right. Well, if you guys couldn't tell already, is flexibility, being flexible. It's important to be flexible, having a flexible mindset. For me, kind of dates back to when I was enlisted in the military. From day one, being uncomfortable because nothing was intended or how I planned. There was constant changes of plans. Sometimes I didn't even know the plan. But at the end of the day, it still worked out for the best. We can try to plan as much as we want, but no one really knows what's going to happen a year from now, tomorrow, a minute, from now. We can assume, but the reality is life is unpredictable. But the only thing we could say that's consistent, I think, is having a flexible mindset. Because however difficult things may be, it's temporary, and we know life is going to continue regardless. So. Yes,
absolutely. Thank you. All right, everybody. Well, we appreciate you tuning in this podcast episode. As always, feel free to hit us up on Instagram or in the comments in this video. And again, thank you guys for tuning in and listening to us. Hope you guys are staying safe and doing well, and we appreciate you. Until next time.
My name is Sato, and you can reach me on Instagram at hardworkpaysoff29.
My name is Carlos Cano, and you can reach me on Instagram at thefit.pa.s.
My name is Carl, and you can reach me on Instagram at whitecoatblack.
My name is Aaron, and you can reach me on Twitter or Instagram at Aaron Anchor.